While the number of COVID cases in other news in Florida appear to be slowly dropping, the state has hit a milestone that shows that the pandemic is still happening.
Florida counted its 7 millionth COVID case this weekend, according to the CDC. Right now, the state is averaging about 6,000 cases a day. The current variant does not appear to be as deadly, and the number of hospitalizations is down.
But there is a new concern. There are reports that the federal government will shift the cost of treating COVID from the government to the healthcare industry and insurance companies. News4JAX reporter Jim Piggott is joining us live to show us what that could mean for future booster shots and what will happen to all those who are not insured. Jim?
You know, Tarek, what it means is we could be paying for it with insurance. And if you're not insured, well, out of pocket. And for many, that could create a problem. Since the start of the pandemic, the federal government has spent trillions of dollars on COVID-related issues, including billions for at-home tests, other testing, vaccinations, and treatments. You haven't had to pay out of pocket to get any of these, but soon you could. This week, the feds may stop footing the bill for the cost and passing it on to insurance carriers. We're already seeing that happen with free COVID tests that you could get by mail. You won't be able to order them after Friday. The question now is, what about future booster shots and medications? Insurance companies may have to pay. And remember this, there are about 30 million people in the U.S. who don't have insurance, and estimates are about 12% of Jacksonville residents aren't insured. That's about 100,000 people. We checked with local health experts today about the impact. Chad Nielsen of UF Health says, given the progression of COVID, this is expected.
So I think what that is really doing is making us face the reality that COVID is going to be here for a long time, and we need to start treating it like the flu or any of these other respiratory illnesses. And I think by shifting the focus on funding for testing and treatments to the insurance companies, it's normalizing the fact that COVID is going to be here a little while, and it's going to be another medical condition like any other respiratory viral disease.
But do you think that would have a problem for the uninsured, the people that can't afford then getting that booster, which we're going to have another booster coming up? I mean,
yeah, there certainly could be some knock-on effects in that those who are uninsured or don't have access to free healthcare or free vaccines or treatment options through health departments will suffer for this. I certainly think that there's a lot of channels that and uninsured folks can still access to get these things.
You know, of course, I did check with the health department today what they plan to do about this situation. And they said here, at least in the Jacksonville area, they have a grant from the CDC. So they believe that they're going to be able to handle the COVID situation should that get bad, and could help the uninsured in this area. At least they have that grant for some period of time. Future, it's not unknown at this time. We're live on the South Bank. Jim Piggott, Channel 4, the local station.